I'm Taylor Fujisawa, and I'm presenting on iatrogenic. It is simply defined as relating to illness caused by medical examination or treatment. You may also see this as iatrogenesis, iatrogenic harm, or iatrogenic disease, and it generally denotes a condition of poor health or adverse outcomes stemming from medical interventions or their absence. Now, while iatrogenesis is commonly associated with outcomes stemming from the actions of physicians, it can also be caused by any healthcare professional. These outcomes could be physical, mental, or economic. One example of a physical outcome would be like a wrong site surgery. Another would be equipment being left inside of the patient. A mental outcome could be related to a misdiagnosis, which may delay treatment or care and cause increased stress, anxiety, or depression. Finally, complications caused by errors in care can lead to repeat or longer hospital stays, potentially resulting in catastrophic medical debt, which may end in iatrogenic poverty. I'll go through a few specific examples. The first is hospital-acquired infections. Globally, HAIs are a leading cause of morbidity and mortality. Key methods for preventing infections include hand hygiene, environmental disinfection, sterilization, the use of personal protective equipment, and the use of transmission-based precautions. One of our articles, it was an optional one in Module 4, touched on infection prevention and compliance in Tanzania, where it was found that hand hygiene and disinfection were inadequate, albeit in outpatient settings, but you do see this similarly in any kind of healthcare facility. Low and middle income countries tend to have additional risk factors contributing to HAI acquisition. These include lack of resources and surveillance systems, lack of personnel and overcrowding, and lack of education in infection control and HAIs. Research has also found that there is evidence of the overuse of surgical procedures in LMICs, and this may generate significant harm and also waste limited resources. The majority of studies are reporting overuse of unnecessary cesarean. And this can be a life-saving intervention. However, it does increase risk of morbidity and mortality for mother and baby. Data shows that providers seize on unclear or presumed indications of reasons to perform cesareans, despite them not being medically indicated nor a patient's preference. Therefore, potential for iatrogenic harm is high, both physically and psychologically. And I actually had a different slide here, but after this week's reading, decided to replace it. The discussion around colonial systems of healthcare felt like a necessary example to include when discussing iatrogenic harm. The Lasker and Manderson articles discussed how medical care was and is linked to colonial systems of power, and this caused significant iatrogenic effects, which continue today. The development of these systems, meant to serve the colonizers and others in power, racialized resource allocation and segregated access to care. So this history has led to structural and systemic policies which are biased, creating worsened and disparate outcomes for certain groups of people. The maldistribution of wealth and physical resources have colonial roots in many LMICs, leading to inequitable access, such as discussed in the rise of primate cities. This creates harmful and inequitable outcomes. Quality care can be unavailable for historically marginalized populations. I also included over-medicalization and the desire for new technologies, as this can cause iatrogenesis through the erasure of traditional healing and also increasing possibility of medical debt. One report I read described this as wounding caused by systems that have too much medicine and not enough care. So iatrogenesis poses a significant challenge in global public health. And while the risk may be higher in LMICs, it is also a major concern in high-income ones. Approximately 40 to 80,000 annual fatalities occur in US hospitals due to diagnostic errors. And while it is generally thought of as a direct harm from a specific medical action, like error or negligence, it also includes harm caused by the structure of the system itself. So it is not solely a matter of disease management, but rather involves tackling the underlying avoidable health disparities and medical costs.